Good morning. My name's Dave Eichelboom. I'm a physiotherapist. I work at Physio Plus, and I also have a consulting company called Eichelboom Physiotherapy Consulting. Today we're going to be talking about lifting and moving and just looking at a lot of the scenarios and lifts that a typical EMS worker will encounter on a daily basis. We're going to think about how we can make those lifts safer and so that we can make sure you guys stay safe while you're doing your job day in and day out. In preparation for these presentations, I looked up some research statistics on work injuries. Most of these statistics are from BC, actually, it's their data. When we talk about work injuries, one of the main areas, or the most common work injury, is a low back injury. Represents about 25% of all workplace injuries. Of those 25%, the highest risk category is healthcare providers. I would put EMS workers into that category. Again, within that category, they talk about the different types of injuries people can have. So there's things like slip and fall injuries, accidental injuries, or what they call exertion injuries. Of low back injuries, the exertion injuries are the most common. They're the kind where someone puts in a sudden effort, such as lifting something or moving something, and hurts themselves doing that. An important piece of information about workplace injuries is the consequence that has for the worker. One statistic that's quite important is the amount of time that is typically lost by an individual who's sustained a low back injury at work. The average in BC for a low back injury is 50 days off work, so 10 full weeks off of work due to a low back injury. When you factor in that someone who's been off work for 6 months or more has an under 5% chance of returning to their substantive position, that's a big risk and something we want to minimize. An important secondary point with that is research has shown that it doesn't have to be just one single effort that can cause a back injury. The tissues of your low back and other tissues in your body will be put under stress even at a sub-maximal load. So even 50% of the maximal load you can take, if you lift that repetitively, that can actually cause the same injury as if you were lifting more than 100% of what you could. The importance of that is, with EMS workers, as you're lifting day in and day out, it's very important that you keep good form, that you protect yourselves, because it doesn't have to be the 450-pound patient who's going to hurt your back. It could be a light patient, could be an average patient on a very normal lift. But if you've put yourself at risk again and again through how you're lifting, your risk of subsequent injury is a lot higher, and we want to try to really minimize the risk in those situations. What we're going to do now is we're going to start doing some actual lifting. So if I could get everyone to line up on the line here with your toes sort of at the line facing this way. What we're going to start with today is doing some squatting, because squatting and lifting are very, very similar, and if you can squat properly, you'll be able to lift properly. So when we talk about lifting, there's two main things, or a few things that we want to keep in mind. People talk about lifting with your legs versus lifting with your back. People also talk about keeping your back straight while you're lifting. Both those statements are true, but they mean something a little different than what they're commonly interpreted as meaning. So when people hear lift with your legs, they picture not lifting like this, with sort of this straight leg lift. So what they do instead is they lift like this, where they come really far forward with their knees over their feet, the heels lift off, and they're kind of balanced on the balls of their feet. This position's a bit tricky because you don't really have a ton of balance. You also don't have a ton of stability in this position. The other thing you'll hear people say is keep your back straight. A lot of people interpret that as meaning keep your back vertical. So as they go to lift, they try to keep their chest up as high as they can, and their backs end up very arched. The problem with this is that it actually creates certain spots within your back that are taking far more load than they should. When the back is straight, it's very good at resisting shear force and compressive force. When the back is arched, it has a lot more difficulty with both of those things. So a good lift is going to be, if I'm keeping my back straight, even if I'm bent forward, this ends up being a much better position for me than this. Here my back is more vertical, here my back is more straight, and because of that, this is actually the safer of the two positions. So when we're setting up for a squat or a lift, it's the exact same setup. There's a few things we want to do from our start position that are going to ensure that we're in a good position to start with. The first one, my feet, I want them to be kind of about shoulder width apart. They can be turned out a little bit to the side, but I don't want to be standing here like a duck. The reason for that is if I'm standing like this, my hips again are unable to support me. So I'm going to start good start position. I want to think about keeping my stomach a little bit tight as I'm starting the lift. That'll become more important as we start going farther into the lift. As I start to go down, what I want to think about is pulling my knees apart. As I do that, pulling my knees apart is actually what gets my glutes engaged, and that's where the stability in my back is coming from. So a lot of people you'll see squat and they start to kind of cave in at their knees. If you're doing that, you've sort of lost all the stability in your back. So you want to pull them apart as you sink down, and there I can be pretty comfortably in this position because I'm pulling my knees apart. The second I fall in like this, I lose all my stability, and then I'm in a dangerous position. Okay. From the side, a couple things we want to think about. The main one being keeping your shins vertical. What that does is, again, it causes the hips to do more of the work. So rather than starting by sinking my knees forward as I lift, I'm going to start by sinking my hips back. Okay, so this really feels like you're going to be sticking your butt out, but that's okay because that's where you're getting all your power and your stability from. Again, in this position, I can hang out here pretty comfortably. One last point from this position, as I start to go down, I want to make sure my head follows my body. If I'm looking up the whole time I'm doing it, my back is going to arch like you can see it doing now. And when it does that, I've lost a lot of the support and strength from my back. If I let my head follow my body, like that, you'll see that my back stays actually straighter and is in a better position. One last thing from this position, if I am actually reaching, I want to make sure I'm still keeping my shoulder blades squeezed back together a little bit. If they're really rounded out, you can see again, my back sort of rounds out higher up. If I keep them squeezed back, my back stays in a stronger position. And then I'm going to come back up. What we're going to do is we're going to start by just doing a few squats so we can just get used to the movement of it. For the first one, I'm going to get you to just go into a squat and then hold that position. And we're just going to sort of feel it out. If we need to make any changes, we can, and we'll go from there. So can I get everyone to start in sort of that proper stance? Thinking about, again, we don't want feet out like a duck, but a little bit turned out is okay. And I'll get everyone to squat down to the position as if you were going to lift, but just sort of getting down to this position and hanging out there. Okay, go ahead. Okay. So actually, you guys all look pretty good. Yeah, that looks good. So here, what I'll get you to do is actually bring your feet a little bit wider. There you go. And now let your hips sink back. Let your body lean forward, squeeze back through here, squeeze these muscles back. There you go, there. So now you can feel that this is a more stable position. I can kind of push you around a little bit there, and you feel pretty stable. You're not about to fall down. And I'll get you to stand back up. Perfect. Okay, I'll get everyone to do that again. Okay. Think about sticking your butt out more. There you go. Perfect. That's better. Okay, and back up. And down. And back up. Okay. So you can see how you have a tendency to bring your feet a little bit closer together, and what's happening, that's why your back is actually rounding out as you come down. I think if you start with your feet a little bit wider, you'll find your hips open up a little bit and you're able to sink down here a little bit more comfortably. How does that feel to you by comparison?
Awkward, but
awkward.
I feel the stability.
Okay, perfect. You guys actually looked really good with that, so that's good. What we're going to do now is start doing some lifting with a stretcher and with someone on it. Obviously, squatting just without any weight is one thing, but we need to be able to do this in an environment that is something you'd actually have to do on the job as well. So what I'll get you guys to do is go to sort of your start position as if you were about to lift this patient up, but I'll get you to pause in the position when you're down just holding onto the cot, and we'll sort of check the positions there. So I'll get you guys to go into those positions now. Okay. So we can see there's quite a difference between the two positions over here. Very good. Feet are spread apart, knees are apart. You can see the back is straight and the head is falling in line with the back. That looks like a great start position. So with John, there's a couple things that I would change here that will help to make this lift safer for him. The first one, he's actually a fair ways away from the cot he's lifting. You can see there's a fair bit of space between his toes and the cot. So you can also maybe see that his heels have come up off the ground. So this is going to be a more difficult lift for him. John, we're going to change your position a little bit. So I'll get you to stand up, and let's start with your feet and maybe work down from there. So I'll get you to stand a little bit closer to the cot and with your feet a little bit wider. There you go. Now as you sink down, I want you to think about pulling your knees apart. So start to go down into that squat and think about bringing your hips back. There you go. And then reaching down from there. Okay. There you go. Comfortable there? Making sure you're squeezing these muscles here. Good. Okay. So now these positions both look pretty good. The only thing I would change here is I would bring John's feet under his knees a little bit more. Sink more back from the hips. There we go. Okay. So then when you're ready to lift, you can lift. Good. And back down. Okay. And back up. We're going to do about 5 lifts.
1, 2, 3.
And back down.
2, 3.
And up.
3.
Okay, so we can see a difference here between the two. John's back is sort of, you can see it's doing a fair bit more rounding out, whereas Nathan's back is staying a fair bit straighter as he's doing it. What that tells me is that John's using a little bit more of the muscle in his back to do it. A part of that is stiffness. I imagine John's hips aren't quite as flexible as Nathan's, and that's part of the reason that he's having to sort of tuck his tail under as he sinks down. Doing a little bit of stretching of that would make that easier for him. Tim, I'll get you to join us and do some lifts here as well. So we'll go to the start position. So both those start positions look quite good. And whenever you're ready, I'll get you to lift.
3, 1, 2, 3.
Okay, and back down.
1, 2, 3.
And one more time like that.
1, 2, 3.
Okay, and back down.
2, 3.
Okay. So one thing, Tim, that happened as you did that lift, you sort of made it a two-part lift. And this is something we see people do pretty often, where you were here and you were in a really good start position, and when you started to lift, instead of everything moving up as a unit, what happened was your hips came up and then your back kind of tried to make you come up the rest of the way. We definitely want to be careful with that because, again, it just puts your back at a bit of risk. We'll see people do that when they're lifting heavier loads or if they're trying to lift more quickly. So the key there is just to really think about engaging the hips the whole way through the lift. So instead of coming up here, thinking about really driving from the hips, driving the hips forward, thinking about that just as much as anything else. So let's try that again.
1, 2, 3.
Perfect. That was much better. You could see it was just one solid movement rather than that two-part lift. Okay, great. One thing that we see quite often with lifting, and one challenge that happens, is people lifting with a really narrow base of support. So their feet are at the end of the cot, and as they're lifting, they're very much scrunched together like this. You can see from this that my back is very rounded out. It's not straight, and I actually don't have any stability there because my knees are so close together. So it's very important when you're doing these lifts that your feet come wide. My feet are actually sort of overlapping with the cot a little bit. I'm not behind the cot. If I'm there, I have to reach more. My feet are sort of surrounding the cot, and as I sink back, my knees come apart and my arms can easily fit in between. There's lots of room there still, and there should be. In this position, I'm able to lift from a stable position because my hips are engaged and I'm in a strong position. From here, I can't use my hips and I'm in a bit of an unstable position, so this is much more dangerous for my back. So the next thing that we're going to do is a movement where we have to shift somebody. This is not a typical movement you'd have to do, but it is a situation that comes up, particularly in the back of the ambulance, so we want to practice it in a little bit more of a controlled environment. We've talked about using our hips as the source of stability. The same thing applies when we're moving from side to side. What we want to avoid is a situation where we lift and then have to reach outside of our hips. That creates a very dangerous situation. So in a situation like this, what we'd want to do is really go into a very wide stance. So when we're doing that, we're going to make sure that our hips are always in line with what we're lifting. There has to be the capacity for a lot of side-to-side movement here. And that changes the feel of the lift a little bit. So if Nathan and I were going to do this lift, we'd start here, and then we'd lift 1, 2, 3, and then as we bring it over, we're shifting our weight and down. Okay? So the key with that is that, again, the weight I'm lifting always stays in line with my hips. If I have to pivot my hips a little bit, that's fine, but I never want to be reaching outside of my hips because that's where that situation becomes really dangerous. So Nathan will move it back, and then we'll get Tim to do it as well. 1, 2, 3, and down. Okay, Tim, I'll get you to join in. Perfect. Okay. Yeah, that looked really good. Again, really good movement, good shifting through the hips is really the key to keeping that as a safe lift. Okay. And we'll we'll bring it back now.
1, 2, 3.
Perfect. Obviously, in a situation like this, the ideal strategy is to lift and then just take some steps over. However, if that's not a possibility, this is the next best option. Really get those hips moving with it. The next lift we're going to do is lifting with the cot, working on just making sure we're being safe using the gatch with that and keeping good posture while we're doing that. Okay. So with lifting the cot, it's a fairly straightforward lift, a lot like the other lifts we've done. The main concern here is just that the person operating the gatch is in good communication with the person at the head end of the cot. Obviously, if there isn't good communication there can be problems with the carriage being up or down or locked or not. So what I'll get you guys to do is just lower the cot all the way down and then bring it back up.
Okay, we're going to lower down on 3. 1, 2, 3. And back up. 1, 2, 3.
Perfect. Okay, let's do it one more time.
1, 2, 3.
Okay, and back up.
2, 3.
Okay, good. So one thing you'll notice happened with that, because Nathan went to do that lift, he had taken a step back. And you'll notice, and this is something we see happen, the person who is farther back will tend to pull the other person forward. And you can see that then Tim ends up in a fairly unsafe situation where he's holding a weight and he's sort of being pulled forward at the same time. With the dummy here, it's not as heavy, so it's okay. But in a situation where a real person is on the bed, that becomes quite a dangerous situation. The real important message there is just make sure that you're close to the object you're lifting. If you're far away, you're going to end up pulling your partner off balance as you do the lift. All right, let's do just one more lift.
1, 2, 3. And up. 1, 2, 3.
Perfect. The next thing we're going to do is some lifting of the cot into the ambulance. With this, there are just a few situations that come up that we need to be careful with. On a level flat surface, this is a fairly easy routine technique, but when there's things like hills or slippery surfaces or particularly heavy patients, there are certain considerations that we need to make. So we're going to get John and Tim to do some lifts for us. So the first lift we're going to do today is just an ordinary lift on a flat surface which sort of simulates ideal conditions. So John and Tim. The next lift we're going to do is a high lift. So this will come up in situations on uneven ground, or if the cot is not high enough that it can just easily be slid into the back of the ambulance. There's a different technique we use when we're going to lift this way. This sort of lifting technique also works well in the cases of a very heavy patient where someone might lack a little bit of the upper body strength to lift on their own. Or if you're a shorter person, this lifting will be very valuable to help you keep better body mechanics and keep yourself safe while you're lifting. The main consideration when lifting within the ambulance, especially at the head end of the cot, is being able to use the space around us to make sure that we can still stay safe. As I'm lifting here, I want to make sure that I'm still moving my hips as much as possible to make sure that I can always be supported as I'm moving, rather than ending up in a situation where I'm having to lift outside of my base of support. One strategy that can be quite useful for this is to brace your leg up against the side of the bed here. By doing that, that still allows me to keep my hip engaged and stay in a good position as I shift over to do that lift. Now what we're going to do is we're going to do this lift with Tim and Nathan. So as Tim is getting set up at the head end here, you can see he's got a wide stance. He's sort of bracing himself on a few different things. And as he's lifting now, he's going to just make sure he's moving his hips. So as he goes to set up. Perfect. And you can see how he shifted his hips as he put the patient down, making sure that his back was in a good and safe position the whole time he was lifting. Okay, the same thing applies when bringing the patient back over to the cot. Perfect. So from this end, Nathan is just going to make sure that his hips stay in line with the weight he's lifting as much as possible, and again, that they're shifting over as much as he can. Perfect. And then again, the same thing applies as we go in the other direction. Perfect. Today we've gone over several of the lifts you would do in a typical day as an EMS employee. The key message to take home from all this is that your hips are both your source of strength and support while you're doing these lifts. By ensuring that your body mechanics are good and that you're communicating effectively with your partner, you'll be able to minimize your risk of injury on the job.